Hello, this is Dr. Vlies, and we're continuing here with the digestive system. This is part D of the digestive system. In this video, we're going to focus on the oral cavity and the pharynx. The following videos will continue down the digestive tract and ultimately lead to the accessory structures of the digestive system. The oral cavity on the anterior side can be closed off with the help of the lips. It is bordered superiorly by the palate, and here we see the hard palate where the maxilla is located. Further posteriorly in the oral cavity, we have our soft palate, which ultimately leads to that little flappy thing in the back of your throat called the uvula. We'll see that better in just a moment. Let's not forget the very muscular tongue that helps us with mechanical digestion and even to some extent some chemical digestion of our food. The tongue is made up of skeletal muscle tissue. When the tongue helps us move the food into our oropharynx, followed by the laryngopharynx, we need the help of that epiglottis. Remember that epiglottis is important to close off the entry point into the trachea via the larynx. So when we swallow, the epiglottis ensures that our food makes it into the esophagus. Remember that the esophagus sits posterior to the trachea. The accessory structures that help out with mechanical digestion of the food are, of course, our teeth. We have a certain number of teeth. We typically have a total of 3 molars on either side of our mouth in the inferior portion and superior portion of our mouth for a total of 3, 6, 9, 12 molars. We have typically 2 premolars in each quarter of our mouth, followed by 1 canine, also called the cuspid, and then 2 incisors, which leads us to a dental formula that we'll take a look at in just a little bit. These are, of course, mature teeth. I'm going to point out a few other structures. Recall that I pointed out the hard palate versus the soft palate, and I mentioned that the soft palate leads to this little flappy structure in the back of our throat. We call that the uvula. It plays an important role when we swallow in helping with the closing off of the nasopharynx. You'll also see these structures referred to as frenulum. So we have a superior labial frenulum, labial always referring to the lip. A frenulum is a structure that anchors another structure. So for instance, the superior labial frenulum anchors our superior lips to our gums essentially. And remember the term gingivitis, inflammation of the gums. So gingivae refers to the gums. Don't forget your palatine tonsils located in the oral cavity. Here we see the lingual frenulum. Lingual always refers to tongue. Lingo, think of lingo as language. Lingual always refers to tongue. So that's the structure that holds the tongue attached to the bottom of your mouth. If you lift up your tongue, you can see that little structure that is called the lingual frenulum. And our inferior lip is anchored by means of the inferior labial frenulum. The other accessory structure of the digestive system that we're already going to discuss here is the tongue. The tongue plays a very important role in speech, as you know, but we also need it to help with the mechanical digestion of our food, and particularly with creating that ball of our food that we push into the back of our throat with the help of the tongue. And we call that ball of food a bolus. So you'll see that term. Next to helping with mechanical digestion, our tongue is also going to be involved with some level of chemical digestion because it does begin to secrete a lipid digesting enzyme called lingual lipase, not in huge quantities, but somewhat. And it also produces mucus. Finally, in addition to speech and swallowing, secreting materials, and forming the bolus, let's not forget that our tongue contains all kinds of taste receptors located in what we call taste buds. And there's different types of taste buds located in these what we call papillae, foliate, circumvallate papillae, and others. We probably should also add as one of the functions defense, because we have located on the tongue a lingual tonsil, very close to the palatine tonsils in the back of our oral cavity. So our tongue is actually a pretty strong skeletal muscle, and the fibers of the muscle tissue run in different directions, so that we find that some of the muscles are involved in positioning our tongue, while the other ones allow a change in the shape of our tongue. The third accessory structures that I'm already going to introduce you to, and then we'll primarily focus on just the digestive tract, are the salivary glands. The salivary glands can be divided up into two groups. You're probably used to hearing about the extrinsic salivary glands. Those are located outside of the oral cavity. And you see them clearly marked here. They're pretty big glands. We have the sublingual salivary gland. We have the two submandibular, or sometimes called submaxillary salivary glands. And then just deep to your masseter muscle, we have the parotid salivary gland. This big gland, I should say superficial to the masseter, I'm sorry. This gland can become infected with the virus called myxovirus, and when it does, it creates a condition we call the mumps. Each one of these major glands, or extrinsic pairs of glands, have little ducts, for instance, or major ducts. For instance, here we see the parotid duct that carries the saliva that they produce into the oral cavity. This particular sublingual gland clearly shows many little ducts entering into the oral cavity. So what are the intrinsic salivary glands? We often call them the buccal glands, bucca referring to mouth. And they're located throughout the whole oral cavity, and their primary function is just to keep the mouth moist at rest. The extrinsic salivary glands, they tend to be stimulated by receptors to secrete saliva. So they are not always producing saliva. They need to be stimulated. We might not think a whole lot about the saliva we produce, but we know very well that when we don't produce it, as when we get very nervous, it becomes rather difficult to function. Have you noticed that? But with regards to the other functions of saliva, rather than keeping the inside of our mouth nice and wet and more comfortable, we find that because our saliva is slightly acidic, it can function in protective mechanisms. Not only that, it contains proteins that are protective, such as lysozyme and defensins and immunoglobulin A. Now, in addition to these proteins, it also contains an enzyme called amylase. Now, we're going to specify and call it salivary amylase because we're going to see that the pancreas also produces amylase. What does amylase do? It begins the digestion of complex carbohydrates. So polysaccharides, starches, for instance, would be a good example. And so we see that some digestion of these complex carbohydrates already starts in the mouth. And let's not forget that the tongue produces some lipase as well. Another protein that is produced is mucin, which you're familiar with because that is found in our mucus secretion. Of course, that makes everything more lubricated, a little bit sticky, holding everything together. So in addition to these proteins, we have electrolytes, we have wastes, the same kinds of wastes, by the way, that we find in our urine. And we have growth factor. Have you ever noticed that when you have a little wound on the inside of your mouth or even on your tongue, it is healed within just a matter of a couple of days? It goes really fast, and that is due to the fact of growth factors. One very crucial thing to mention, and that is that most of our saliva is water, and accidentally I listed water twice here, but it might be a good thing to remind you how important water is as part of the content of saliva. Most of the secretions produced by the digestive system are going to be rich in water. Notice too the amount of saliva we produce on average per day. 1 liter to 1.5 liters a day. That's quite a bit of saliva if you think about it. So based on all of the components that we just went over, coming up with the functions of saliva shouldn't be all that difficult. Clearly, it's going to cleanse our mouth with the help of the pH and the other protective mechanisms. I mentioned protection again a little bit further down. Cell growth and repair. Amylase digests the starch. With the help of the tongue and the saliva, we can better form that bolus. And let's not forget that all of the water inside of, or that makes up part of the saliva, helps dissolve the food chemicals as well, so that the chemoreceptors that are part of our taste buds can also respond to those chemical stimuli. So we've gone over the anatomy of the oral cavity along with the pharynx. We've discussed the anatomy of the accessory structures, that is the teeth. We'll come back to the teeth some more in just a moment. The tongue, as well as the salivary glands. And we've looked at the components of saliva and based on those components, what the functions are of saliva. What we still need to do is take a look at how salivation, that is the making of saliva, is regulated or controlled. And of course, as we all know, there are different ways in which we might be stimulated to salivate. If we think about food, if we see food, all of these, if we smell food, so it shouldn't just say the thought of food. It is, many of these other things that involve our special senses can actually ultimately trigger those salivary glands. And of course, the mere act of putting food in our mouth is going to influence the chemoreceptors and the receptors that respond to the pressure of food in the mouth. When the receptors are stimulated, they are going to send signals to the brainstem. In the brainstem, we find salivatory nuclei. And from the brainstem arise parasympathetic fibers that then go down 2 major cranial nerve pairs. That is the facial pair of cranial nerves as well as the glossopharyngeal cranial nerves. If it's been a while since you've studied the cranial nerves, please get a picture out, get online and look at all the different cranial nerves and get a feel for where they arise and where they go in the body. So these 2 nerves play an important role in triggering salivation of the extrinsic glands. Remember those extrinsic glands, they need help from the nervous system to start salivating. The buccal glands, the intrinsic glands, they tend to secrete all the time, even at rest. Now think, when do you salivate? When we want to eat, when we're thinking about food. Basically, we're starting to salivate when our parasympathetic fibers are activated. It is our parasympathetic nervous system that stimulates digestion. If that doesn't make sense to you, let's go back to feeling really, really nervous. And what happens when we feel really, really nervous and we have to give a public speech or we have to give some kind of a performance? The reason why we get that dry mouth is when we're under stress, the sympathetic nervous system kicks in. And the sympathetic nervous system is going to cause enough vasoconstriction to where ultimately the glands cannot produce a watery saliva, and we end up with this really thick saliva and dry mouth that we're all very familiar with, I'm sure. So just a few more things about teeth. Remember, we have our permanent teeth, but we also have teeth when we're still kids called the primary teeth. Supposedly, on average, all of our teeth have finished forming by the age of 21. Let's just focus on the permanent teeth, and if you go back to my discussion in the previous slide of how many teeth we have, you should have come up with a total of 32 permanent teeth based on how many there are in each quarter. And of course, that includes all of those molars. Many of us have our wisdom teeth, that third molar removed, but we need to include that in this count. Often a formula is used to represent the teeth in a person's mouth, and we see that formula here at the bottom of your screen. So this upper row represents the upper quarter of your mouth. This represents the lower quarter of our mouth, which means that we must multiply each one of these by 2. So we have in the upper quarter 2 incisors, or really a total of 4 in the upper half. A canine, 2 premolars, and 3 molars. Similarly, we see 2 incisors, 1 canine, 2 premolars, and 3 molars in the bottom quarter of our mouth. If we multiply this by 2, in a perfect world, we all have 32 permanent teeth. The number of primary teeth varies, and again, you can use these numbers I've listed here to help you come up with the total number of primary teeth. A tooth is made up of 3 major regions. We have the crown, we have the neck, and then we have the embedded part called the root. Our teeth are anchored via what we call periodontal ligaments to form a type of joint called a gum facies. You might remember this from AMP1. The living part of our teeth, which can create a lot of havoc, is called the pulp cavity, and that is where we find blood vessels and nerve vessels. The pulp cavity is covered by this bluish layer of dentin. And then finally, superficial to that, we have the enamel. So the enamel is this layer right here. This is the layer we really do not want to erode because it really forms a healthy protection for our teeth, and it's not replaceable. We've studied the anatomy of the pharynx before in the respiratory system, but when it comes to the digestive system, only 2 regions of the pharynx should be discussed because they serve as passage points for food, and that is the oro and laryngopharynx, and both of them are lined with stratified squamous epithelial tissue. Remember that stratified squamous epithelial tissue always functions in protection from friction. And what are we protecting from friction from? And that is, of course, the food that we are bringing into our mouth and into the back of our throat, eventually into our pharynx, down into the esophagus. The esophagus still is lined with stratified squamous epithelial tissue. We find some mucus glands along the pharynx, but we also see that it's a very muscular structure After all, it is involved in the swallowing process. So we have an inner longitudinal layer of skeletal muscle, and then we have these 3 stacked constrictor muscles, and you see them listed here. We have a superior pharyngeal constrictor, followed by a medial one, followed by an inferior one. And so this wraps up our discussion of the oral cavity with its accessory structures, namely the teeth, the tongue, and the salivary glands, and the pharynx.